South Africa's globally lauded HIV program, once hailed as the largest and most successful of its kind, is currently facing an alarming unraveling as foreign aid funding dries up. We all know the story of PEPFAR. We all know the story of USAID, and how the cutting of that funding has impacted our local clinics, communities, and households, and the results being medication stockouts to retrenched health workers and ultimately a collapsing support system. The consequences are already becoming deadly. We asked the question today, are we on the brink of a new wave of infections and deaths that I think we've seen at the beginning stages of when HIV and AIDS started becoming a pandemic in South Africa in the late 90s and early 2000s. And to help us unpack this crisis is Sibongile Tshabalala, the national chairperson of TAC, Treatment Action Campaign, an organization that was at the forefront of the fight for access to antiretroviral treatment during those dark days of HIV denialism in South Africa. And they're also very, very vocal and at the forefront of advocating for the rights of the people living with HIV and AIDS. Sibongile, thank you so much for joining us. Really appreciate you giving us your time this morning here on Salam Media.
Thank you, Slayelo. Thank you for having me. And yes, I hope will have a good conversation together.
The pleasure is all ours. I think we can kickstart the conversation with, TAC. You guys are on the ground. You guys are at the center of the struggle of HIV treatment access. You've been at it for decades. We currently witnessing the cutting of USAID funding. We are seeing PEPFAR programs being cancelled. From what you guys are witnessing on the ground, how dire is the situation? How serious is the impact to the most vulnerable in our communities and those that are still struggling when it comes to this scourge, this pandemic that is HIV and AIDS?
Honestly, the situation for now, we might think that it might look as if it's not that bad, but honestly, it's really it's starting to show the impact of not having enough funding or the PEPFAR cut funding. We are starting to experience people being turned away from facilities and people being given 1 month treatment where they are told that it's because of the issue of Trump. But honestly, slightly, if you remember, these are the issues that we've been having for a very long time, even though PEPFAR funding has been supporting our HIV programs in the ground. But without funding, then we are now experiencing more of these issues on the ground where people are given 1 month treatment, where people are told that there are no services that are running faster in facilities because of these issues of funding. And we know for the fact that this is happening because, yes, the supporting structure of HIV, the supporting programs, the HIV counselors in facilities, the mobile clinics or in the hotspot areas are no longer there. So people are left without any a substitute of services, especially HIV services, but mostly affected communities are foreign nationals and key and vulnerable populations where they were accessing healthcare services mostly in the hotspot areas and PEPFAR funded support structures.
You mentioned some of the reports that you've seen of some of the PEPFAR funded organizations retrenching thousands of staffs, clinics closing down, and that PrEP initiative that everyone was excited about now being stuck in limbo. How has the Department of Health responded to this? Have they engaged with you guys? Have they provided any plans for meaningful alternatives to fill this gap that has been left by the funding of PEPFAR?
The engagement that has happened with us, especially Treatment Action Campaign, it is happening, but in a very slow pace. Unfortunately, we don't know of a plan to cover these gaps. But what we know is that the government is trying to look at the impact on the ground. But for now, we don't have a comprehensive plan to say how is government going to respond to these issues. How are they going to close the gaps? Because the issues that are coming mostly is the issues of budget, to say the country doesn't have enough resources to cover for all these programs. But also, what we are learning or hearing is that the challenge that the government is saying they have is that these implementing partners were paying their staff high salaries. That's the argument that they have for now, to say they can't afford that salary scale, because their staff members, they were earning more than the government salary scale. So that is the issue for now that is at hand. But I don't think and believe as an activist that is an issue that can hold us back. What we need to know is that how is our government going to cover or close the gaps in terms of the huge gap program implementation of these HIV services that are disrupted because of PEPFAR funding. So for now, we haven't got any substantial plan to say how is this going to be affected. But also the issue of monitoring of services from the government side, we haven't got any a thing that we are going to hold on it to say how is the government monitoring the impact on the ground. Only what we know about it for now is that provinces are reporting to the national level, but at what scale for now, we are not sure, because I think the conversations have been happening the past few weeks. But for now, we are not sure what's the plan from the government, other than the 1.1 million campaign, which addresses the challenges that we already had.
You're speaking of a lot of unsurety when it comes to the approach and the reaction from government when it comes to responding to these funding cuts by PEPFAR and USAID. Do you believe our government still recognizes HIV and AIDS as a national crisis, or has complacency kind of taken hold because of the successes of mitigating the scourge of HIV and AIDS and the deaths, which can be attributed to PEPFAR and USAID?
Yeah, I think our government, they are taking things for granted now, and they think that they are holding it. And I don't see the sense of agency in terms of dealing with these issues. I see that they are just responding in a very normal way, which for me, I think we need an agent response. We need to see the president, the deputy president leading in terms of this response. But I think it's mostly left to administrative part of it. But we don't see most of political will taking charge of this issue and saying, as the government of South Africa, this is what we are going to do, and this is what we are intending to do, especially from our deputy president as the chairperson of the South African National AIDS Council, which is the coordinating structure in terms of the HIV response in the country.
And just lastly, before I let you go, there's mention that South Africa still has, world-class infrastructure. It has well-trained expertise and people on the ground that are able, to deal with this pandemic that is HIV and AIDS. Do you agree with that? Do you agree that it's not too late to turn this around, or is there still hope if leadership acts now?
There is hope if leadership acts now. Yes, that is true. We have a lot of resources, and we have experienced staff in terms of responding to HIV. We have responsive communities in terms of HIV. If you remember, Slilo, from where we are coming back from, it's our effort as communities. It's our effort working with health professionals that are committed to fight HIV. So when we get a political will and an agency on this matter, things can be turned around. We did this before, we can do it again. But if we delay the programs, we delay everything, we politicize this issue, then unfortunately we'll face consequences in the next coming few months, not even years.
No,
Months.
definitely, Sibongile. Thank you so much for chatting with us. I think you offered some very, very valuable insights, but we're going to leave it here for now. Really appreciate your time.
Thank you very much.
There you go. That's Sibongile Tshabalala Madala. She's the national chairperson of TAC, Treatment Action Campaign, the people that are in the forefront when it comes to dealing with the scourge of HIV and AIDS in South Africa. And I think we can all agree that what we are witnessing now is the painful unraveling of a system that South Africa became far too comfortable when it comes to relying on PEPFAR's extraordinary support. And while, life-saving and, the support is crucial, our government allowed itself to take its foot off the pedal instead of building a resilient, self-sustaining HIV and AIDS response. They outsourced urgency and accountability to foreign partners like USAID, like PEPFAR, which now have said we're not going to do this anymore. So yeah, I think there needs to be accountability when it comes to the response. We by now, we've been dealing with the scourge of HIV and AIDS for almost 85 years now. By now, we should have self-sustaining systems that are in place, that are able to work, regardless of whether you have support from foreign agencies like PEPFAR, like USAID. But, our Department of Health, our government was like, well, the Americans are handling it. So, we'll just chill. And there are budgets, from Treasury that come out. But because there's so much outside funding, what happens is, well, they'll chow that money because the work is being done. The work is being done, by other people. The work is being done by foreign, groups like USAID, like PEPFAR, and they ultimately, didn't feel there's a need for government to own, these institutions, to put the right systems in place to make sure that we don't go back, to the early days of HIV and AIDS, where people were dying almost every week because of not having the right access to HIV and AIDS treatment, not having enough education when it comes to how to mitigate and to, make sure that HIV and AIDS is dealt with correctly. And we have those in place now. And as you heard from Sibongile there, we could easily lose the systems in a space of months, and we go back to those dark days where people were just dying painful, horrible deaths. And I think it's government's neglect ultimately that would be to blame for the collapse of South Africa's HIV response. We have some comments coming up. I'm sure X can put it on the screen, where you guys are essentially voicing out your opinions. You're telling us what you think about government's response. X, comment on the screen. All right, we have Carl S. June, and she says, I don't think South Africa is coping with the HIV treatment crisis. They said they would fill the gap. I don't think so. And that's true. That's true. They're not filling the gap, and there doesn't seem to be any urgency. The president has not come out to say, well, with PEPFAR and USAID no longer in the picture, this is what we're going to do. These are the steps that we're going to take to mitigate, the absence of USAID funding. But, they're quiet, they're complacent. There's this thinking that the systems that are in place now because of PEPFAR and USAID are going to remain, but they won't. They need money, and money that's no longer coming in for South Africa. We're going to take a quick break. When we come back, News and Views continues after this.